We started seeing an increase in overdoses in January, and that started with Deputy Chief Hogan saying, like, hey, we saw this in 24 hours. This isn't normal. And us starting to look at, like, yeah, this happened today. And we really started to see these peaks, and there wasn't much time between them. We're seeing overdoses being harder and harder to reverse and happening in a lot more public spaces, which, again, this is something that isn't our normal usually. And I really do think with what's happened the last few months that this is our normal now.
And when we're looking at close to 1,000 overdoses that just the fire department has responded to, the impact on individuals' lives, on the staff who are responding to this, on our hospitals. We have had reports that there are 8 ambulances waiting outside of a hospital, and 5 of them are overdose patients waiting to be transferred in. So an unbelievable impact. And then not even, we have to think about the deaths and the impact on those individuals and their families. We have started to see a little more of a leveling off to about an average of 10, but that compares to our average in previous years was about 4 a day. And now we're averaging about 10 a day. So still over doubling the number, and the need is still definitely out there to address this issue.
It has been overwhelming and exhausting, and we are losing players who are helping to support this crisis, which is making it even harder on everyone else. We continue to work urgently with all orders of government to try to get to the other side of this crisis, and with community partners, with our business community. Everyone knows that this is the foundational issue that we need to address. And we need a different approach. We can't keep doing the same thing over and over again and expect a different result. We need to have a fresh perspective, and foundationally, we need housing. Unless or until people are safely housed, none of this is really going to change. For all of the reasons people have mental health, addiction, and trauma, that doesn't mean they can't be safely housed.